My name is Alexis Amons, and I chose to do my etiology disease project on tetanus. So, tetanus is a disease caused by an infection. It's characterized by muscle spasms and lockjaw or trismus. There are no laboratory tests to confirm the diagnosis of tetanus. It's strictly a clinical diagnosis, so doctors look at symptoms instead of drawing your blood. They don't have any official laboratory test to confirm the diagnosis. So there are four types of tetanus. The first that we're going to be discussing right now is generalized tetanus. It's the most common form, characterized by muscle spasms, lockjaw, facial grimace. It can progress into stiff neck, difficulty swallowing, rigid calf muscles, fever, dysrhythmias, and even death. Generalized tetanus can occur up to 4 weeks. So you can be sick with active infection for 4 weeks. Recovery can take months. The second form of tetanus that I'm going to be discussing is neonatal tetanus. It's a generalized form of tetanus that occurs in newborns. So it's pretty much the same thing as the generalized form of tetanus, although this one occurs in neonates. This can happen whenever the mother is not vaccinated, if mom is not caught up on booster shots. It's mainly caused by contamination while cutting the umbilical cord. Symptoms include poor feeding, facial grimacing, and rigidity. It can cause some long term neurodevelopmental impairments to the baby. Third form of tetanus is localized tetanus. This is contraction of muscles at a site of injury or infection. Localized tetanus can persist for weeks. It's not fatal. Localized tetanus in itself is not fatal, but it can progress to generalized tetanus, which is fatal. An example of localized tetanus could be stepping on a nail or hitting your foot on a rock and, exposure of your skin by a small laceration or something like that, and that is localized to your foot or to your lower extremity. You may not have full body symptoms, but you're going to have symptoms in that leg that was injured. So the fourth and last form of tetanus is cerebral tetanus. This is a more rare form. It's localized to muscles and nerves of the head. It can be caused by head trauma, skull fracture, laceration, eye injuries, or even dental procedures. So if your dentist isn't using sterile equipment while doing procedures in your mouth and you're not caught up on your booster shots, then you could be a victim to cerebral tetanus. Symptoms of this include neck stiffness, dysphagia, deviated gaze, so a lot of neurological symptoms that could even possibly mimic a stroke. Cerebral tetanus can cause respiratory failure due to paralysis of the laryngeal muscles. So, if your laryngeal muscles become paralyzed, you may end up in the hospital for a long, long time because you had to be intubated. Intubated for oxygen. If you're not intubated and your laryngeal muscles are paralyzed, you could die due to respiratory failure. Spore forming anaerobic bacterium. It's most commonly found in the soil, dust, or animal feces. So, practically anywhere you can find Clostridium tetani. Here's a quick example of what Clostridium tetani looks like underneath a microscope. As you can see, it is a gram-positive bacterium. So, some more information about tetanus. Tetanus spores require anaerobic conditions, so dead tissue with low oxidation reduction potential is an ideal environment for Clostridium tetani. After germination, these spores release tetanospasmum. Tetanospasmum enters the bloodstream and the presynaptic terminals of the nervous system. So after it enters your blood, it enters your nervous system, which then paralyzes muscle fibers. Your motor reflex response fails, which results in the tetanic spasm. So Clostridium tetani first enters your blood and then your nervous system, which then paralyzes muscle fibers, and that's what causes the uncontrolled contractures of your muscles. Clostridium tetani is found worldwide. It's more commonly found in hot and wet climates. The incubation period is typically 7 to 10 days, can last as long as 30 days. So, some examples of mode of transmission for Clostridium tetani are wound punctures, lacerations, skin breaks, insect bites, or an infected syringe. So, just about any circumstance where your skin is lacerated or broken and your tissue is exposed to the environment. Here are some examples of high risk populations that are at higher risk of potential for infection of tetanus. People who have not been vaccinated, so people who are not caught up on their booster shots, IV drug users, or people who are immunosuppressed. So, someone who is already sick, they're vulnerable to getting this infection. Another example of someone who might be at a higher risk is, you know, an older person that has uh, diabetes or something, and they step on a nail or something that slightly lacerates their foot or injures their foot and they don't feel it, they may not pay attention to that until they're having symptoms of tetanus. So here is a pretty gnarly photo of someone who's dealing with a necrotizing soft tissue infection caused by IV drug use. So this is what looks to be like somewhat of a localized tetanus infection. They probably were injecting themselves with a dirty needle. They expose themselves to be vulnerable to get infected with tetanus. So some mode of transmission symptoms. The median incubation period is 7 days. Often patients do not recall the injury, so very minor injuries a lot of the time, something that is not cause a lot of pain or something for them to really need to remember. Clinical features include lockjaw, facial grimacing, muscle spasms, which are very painful, drooling, urine incontinence, and back arching spasms. Spasms can be triggered by noise, touch, or light, which I thought was pretty cool. I did not know that. So, here are some treatment options for tetanus infection. These include tetanus immunoglobulin, antibiotic therapy, and neuromuscular blockers. A lot of supportive care is needed. Supportive care for respiratory complications. So, respiratory failure, someone who may be dealing with laryngeal paralysis, they might have to be intubated and put on a ventilator. Immunization after recovery from the disease. So, if someone gets a tetanus infection, it really ensure that they're keeping up to date with their booster shots. They recommend you have a booster shot every 10 years, although 5 years if you have a severe wound or a recent surgical operation. Some complications from tetanus are vocal cord paralysis, respiratory distress, long bone fractures, joint dislocations, aspiration pneumonia, and coma. Um, I thought that it was kind of interesting that these muscle spasms can be so intense that they can literally break your bones. That has to be unimaginable painful. So a lot of management for pain and symptom management for the treatment options of tetanus. And I just kind of wanted to finish off with do you know if you're up to date on your tetanus vaccine? I surely know that I don't know if I am. feel like it's a not a big concern for your generalized population of people. A very big stereotype about tetanus is that people are truly only concerned if you get cut with a metal object that is rusty. I feel like that's what people think of when they think of tetanus. Um, Although, after this presentation, we now know that there are a lot more ways to get tetanus. So it's very, very important to know if you're up to date on your vaccine, just because a lot of minor injuries can cause an infection. One of the main things I thought was most interesting when learning about tetanus was the neonatal tetanus, and how if mom is not vaccinated or caught up to date with her booster shots, that can actually put the neonate at risk. I thought that was very interesting, with just something as simple as cutting the umbilical cord with, not a septic instrument or piece of equipment can expose the neonate to tetanus. And thank you so much for watching my presentation on tetanus.